Dental radiographic exams are one of the primary diagnostic tools to determine disease states and to formulate the appropriate treatment. Radiographs should be prescribed according to selection criteria guidelines. These guidelines are based on a variety of factors, including the patient's medical and dental history, clinical signs and symptoms of disease, risk factors, age and dentition, and new or recall status. Dental radiographs are valued diagnostic tools when the image quality is adequate enough for proper interpretation. To do this, it is imperative to correctly place the image receptor in the mouth and ensure that the primary X-ray beam is centered and aligned correctly in both the vertical and horizontal angulations. At this time, it is crucial to minimize patient exposure to radiation. Successful images require the use of careful technique and precautions to maximize their diagnostic and interpretive value. This video is provided by Dentsply Sirona and is to be used as a guide to enhance the clinician's skill in acquiring quality radiographs. This informational guide is not intended as a replacement for the Directions for Use manual for any product shown. Always check your manufacturer's guidelines for recommended use of equipment. Bitewing radiographs are considered part of the routine dental assessment. It may be 5 to 7 years between full mouth sets, and bitewing X-rays are an important diagnostic tool to monitor disease and health during this time interval. To properly detect caries and periodontal disease, it is essential to capture open contacts between teeth and maxillary and mandibular bone levels. It is important to ensure that the central ray is perpendicular to the image receptor. Placement for the premolar bitewings will often require an adjustment of the sensor to capture the distal of the canine and avoid overlapping. On premolar bitewings, center the image receptor behind the second premolar. Indicated for horizontal and vertical bitewing radiographs when using digital sensors. The Fastab Bitewing Holder is a disposable adhesive bitewing tab for use with Rinn Tight Sensor Covers. To help the clinician aim for success, the Fastab Bitewing Holder has a permanent adhesive to keep the holder from moving or separating from the sensor during the procedure, is molded with an interproximal slot designed to help prevent overlap, and is available with an optional positioning arm and ring to accurately align the X-ray cone with the Fastab Bitewing Holder. Features and benefits include an interproximal positioning slot, which aids the clinician in visualizing the central ray being parallel to the interproximal spaces, which will help open the contacts. The base is large and the bite tab is wide, which helps the occlusal engagement and stability. There is improved patient comfort with less bulk. To place the tight sensor cover on, insert the sensor flat side down towards the white tab. Once started, the paper backing can be removed. When you reach the tight part of the sensor cover, hold the sensor at the bottom with one hand, and with the other hand move the sides of the cover down over the sensor. Do not push or pull on the cord to place the sensor into the sensor cover. Attach the Fastab holder onto the sensor cover in correct orientation for either horizontal or vertical bitewings. Press the holder firmly for 5 seconds to ensure a permanent bond to the sensor cover. Position the holder in the patient's mouth. Have the patient close slowly. Align the X-ray tube using external landmarks and using optional positioning arm and ring if desired. Take the exposure and adjust as needed for the next desired position. Thank you for viewing this instructional educational video brought to you by Dentsply Sirona.